Hi, I'm Nadim Aslam. I'm an orthopaedic consultant. I specialize in robotic hip and knee replacement surgery. And we've just found out the great news that we at Spire South Bank and myself personally have done more robotic hip and knee cases privately last year in 2025 than any other hospital in Britain. I'd like to thank yourselves and the patients who've been involved in that care. The question now I often get asked is, what do you see as the future of hip and knee replacement surgery? I now believe, and I'm clear on this, that joint replacement surgery in the future will involve robotic assisted technology. I think if the surgeons can combine minimally invasive techniques and the robotic surgery, that will give them even better outcomes. But we must understand that, surgeons are experienced. I also myself have done over 5,000 to 6,000 cases manually. So I do understand fully what manual techniques involve, and I understand now much more what robotic techniques involve. So I'm in a position to make comparisons and to show improvements. Surgeons, some of them are reluctant to take on new technology, some of them are against new technology, and it's up to patients now to look into what they need. I'm now seeing patients from around the country, and more recently I saw a patient who had spoken to a colleague in America and looked into her techniques. Now in Britain, traditionally, the patients will assume that all surgeons are doing the same operation and the same technique. This is not the case. There's a huge variation in what surgeons do, and it's up to yourselves now really to do the research, look at your surgeon, go onto the National Joint Profile, look at their numbers, look at their outcomes, and look at what really they're doing. Now, the future, you must understand, is very, very promising. We're going to see in the future the development of AI, and I think the future will involve very accurate mapping of your anatomy and very specific bespoke adjustments of your joint replacement. The technology exists out there for the robot to actually do your operation, but this is not being executed at the moment because patients, and I agree, want the comfort and the safety and the knowledge of the surgeon to make the final adjustment. So the robotic surgery systems that we use, the surgeon is in control all the time. Now, not all robots are the same. As robotic technology becomes more moving into the forefront, many companies are now introducing robotic systems, and a lot of these companies don't have the track record or the hype, but it's used as a commercial tool just to sell cases for patients. The best systems, and the best system in the whole country with a 20-year track record, is the Mako robotic assisted system, which is a CT image based system. The other systems that are out there are navigation systems. A CT based system will take a CT of your knee, and it will very accurately map your anatomy. And then at the time of the surgery, the surgeon will take points from your bone and map it onto the model that's created. If there's a discrepancy, the surgeon will not be able to proceed. And that is called a CT image-based system. The leading system is what I do, which is known as the Mako robotic assisted surgery. Other systems out there are navigation systems. I personally am much more cautious with navigation systems because the navigation systems don't take into account the structural anatomy of your knee. So I can give you a simple example. You know where you live, you know how to get home. If you buy a car which gives you the latest navigation system and you put in your postcode and it starts to take you around a different way or a bypass, you know how to correct that. You'll say, no, I know how to get home. The problem with the navigation systems is surgeons who are not experienced, they will put the data in. If the data and the points are not accurate, they will follow the procedure, which can, in certain cases, with the wrong information, give rise to a worse outcome because the operations are not done accurately. And I've seen that from the traditional techniques. Whilst I accept the new navigation systems are improving, I think that unless you have a three-dimensional model of your knee, whether it's a CT scan, and in the future, hopefully it'll be an MRI scan, that's a much more accurate way to get your surgery done. We now plan to expand on the success that we've had. We plan to look at, we're all the time we're looking at the way to improve things for our patients. We want to try to minimize the pain patients have, increase their function, increase their recovery. So whilst the surgery is something that we're always developing and fine-tuning, we're also now going to look at rehabilitation techniques to get you stronger and fitter for the surgery, get you the right physiotherapy, get you the right mental health for the operation. And we'll be also looking at how we can improve your outcome by giving you a personalized package, which not only includes an operation, but it includes rehabilitation, intraoperative care, post-operative rehabilitation, and improving your general health. We hope that's the future and we can optimize things for you, and we'll be more than happy to see you. If you require, just let us know anytime. Thank you.